And so if you work from your 20 years old until you're 65 years old, you've now worked, let's see how many years? 45 years, right? So for 45 years, they take out $720. Who got the calculator? Because you know this, I'm a doctor, not a mathematician. Somebody work it out for me. 720 times 45 years. How much is that? 32,400. So that comes to 32,000. You said 400? Okay. Hold that number in your brain for a minute. So let's go back out to the story. Medicare, dollars come from the Fed, that while you were working, every 2 weeks or every month, they took money out. That money went in a piggy bank for 40 years. And every month, they pay for your health, your insurance, your health insurance. Because if you work for a company, your company, while you were working, if you were lucky, had insurance benefits. And that company paid your insurance. But now you're retired, you're not with the company anymore. Your insurance benefits are coming from the Fed, called the red, white, and blue card. Now here's where it gets tricky, because the math has to math. Okay? You put in $32,400. Now, the Fed's paying with the red, white, and blue card. Has anyone been in the hospital? You have. I've been in the hospital. Now, I'm going to use me because I know my numbers and I don't mind sharing. Since I had cancer, the first time that I did my test to find out, they had to do a mammogram, ultrasound, then they did a biopsy, right? They also had to put in a port to give me the medication because I had chemo. With my insurance, I had to pay $8,000 before my insurance would pay anything, right? The BB, the BC. So 8,000, right? Now I'm giving you numbers. Now, I've never been hospitalized any other time except for children. I also had surgery twice. To sum it up, by the time I finished my care for cancer, and it's not done yet, my bill was over $250,000. Okay? That's just cancer. Now, does anybody know the average cost if you go in the hospital just for 3 days? Say you had chest pain. Anybody had chest pain and had to go in the hospital or the emergency room? Yes.
I stayed overnight.
Overnight. Did you see the bill?
$13,000.
24 hours. Hospital was how much?
$13,000 for a bill.
And okay, so 13,000. Now, you only did that one time?
I've been several times.
Okay.
But I only noticed the bill that time because I went in about 3:30 that afternoon, and they didn't take me in until about 5 or 6. And the next day about 5:30, I was going home.
So now you're looking just 24 hours. They didn't even admit him for the stress test, the vascular studies, the cardiology consult, the neuro consult, the EKG, the echocardiogram, the CT scan of the chest. $13,000 less than 24 hours.
That's what the bill was.
Now, he said he went a couple times. Let's say he wasn't admitted. So let's say couple meaning 3. What we got now? So if you go in the hospital, no admission, 3 times, Let's look how much money you put into the system in 45 years and what you just spent. The math ain't mathin'. The math ain't mathin'.
So you don't draw interest on that?
Interest, girl. Okay, give me 2% interest. Give me 10% interest. Let's put 10% interest on this. Let's add 3,000 to it at 10% interest. Okay? So now we got 35,400. Okay? The math still ain't mathin'. And I really need you to understand this. If you work for 45 years and you put $60 in, or even $100 or $200 in, one event in your life, one hospital admission, one cancer scare. You don't even have to get chemo, just a scare will wipe out your deposit. Why do I say that? Because it's important that you value your Medicare and use it wisely. Use it wisely. Yes, ma'am. Question.
What happened to that? Okay, your bill was just over 39,000, and you already had 32,400. That's when you would start getting the bills of the difference, right?
No, it doesn't work that way. When you reach Medicare, 65 or older or disabled, if you have straight Medicare, red, white, and blue, you have to pay 20, I need more colors because this is important. We're going to do blue. You're going to have to pay 20% of whatever that bill is. The government, from your deposit, will pay regardless of how much it costs. Once you hit Medicare age or disabled, whatever the bill is, $250,000, $39,000, Medicare will pay it. But if you're red, white, and blue, you must pay 20% of the bill. So, sir, if your bill was $39,000, what's 20% of $39,000? You got that stored somewhere? You better keep that money in the bank because you're going to have to pay your 20%. The hospital is going to send you a bill for $39,000. Okay, I don't go to the hospital, Dr. Powell. I never get sick. I'm good. The only thing I do is go for, my regular exam. All I have is high blood pressure. I keep it under control. So I only see my cardiologist. Well, the average cardiologist office visit, anybody knows? They're specialists, $250. Okay? You have Medicare, red, white, and blue. You're going to have to pay 20% of this $250 if you have the red, white, and blue. So you're going to have to keep a little savings somewhere. Yes, ma'am.
Okay, so it doesn't matter if you're under one of the health plans like this.
I'm going there.
Okay.
So if it's $250, how much is this payment going to be? How much you have to keep in your pocket when you walk in? You're going to have to bring $50. Okay? So you're going to have to bring your $50. So don't act like, what you mean I got to pay $50? That's the contract. You have Medicare. It's red, white, and blue. The agreement in the contract says government pays 80%. You agree to pay 20%. Plus your monthly premium. So every month you pay, well, you don't really pay. They take it out. And you, wherever you go, whatever service, ER, hospital, doctor, you agree to pay 20% under your contract as a, what I call free Medicare patient. You're free to go wherever you want to go. You know, I call it's a freedom plan. You don't ask anybody to go there. You don't get an authorization. You don't get permission. You're free to pay 20%. There's a cost for freedom. That's the cost for freedom, 20% on Medicare. Now you say, well, I ain't paying that. Well, if you're not going to pay that, or if you're on a fixed budget, and right now we all be on fixed budget between gasoline prices, rising food costs, so you have an alternative. And I have a special to tell you, what's that alternative?
And plus, it's another plus a monthly premium on Part B, which is for 2023, is $164.90 per month. That's Part B beside the 20% that you have to pay, while you access the service on the Medicare. So Part B premium has to be paid. If you don't pay it, it's gonna be suspended.
Okay. Question? Yes.
I was in the hospital like January, beginning of February. So that's 2 bills.
Yes.
So
Who do you have? Medicare?
I have Medicare.
Yep, 20%.
So it's something in the bill out.
Mm-hmm.
I'm not supposed to pay anything for that $50 copay. So the bill say $350 that I had to pay.
Well, that means your bill must be much higher than $250.
Well, anyway, they put both times I was in the hospital on one bill.
Yes.
I didn't see the other one.
Mm-hmm.
I called up my insurance company.
Oh, okay. So you have HMO, which is different. Now, so let's talk about, okay, the freedom is a little too much money. So if you think the 20% is too much, the other thing that you can do if you have Medicare is enroll in what many of you have done, which is what? An Advantage plan. New color. You enter into what is called an alternative Medicare plan that they created called the Advantage plan. Right?
That's on the Part C.
Now, this allows you to see a specialist, go to the hospital, get medication, eye exam, dental, a whole lot of other stuff, and not pay this 20%. In fact, you pay zero. But it's not free. You don't get to go wherever you want to go, see whoever you want to see. You must stay within, and remember this word always. Net, say it loud and proud. Network. You must understand the term network, because you give me a hard time when I tell you you want to go to this doctor and I say, I'm sorry, but they're not in your network. That means the insurance company doesn't have a contract. That contract says we will see your patients for a specific amount of money. For example, instead of charging $250, they may have a contract that says, okay, all of your patients, I'll see them for $50 instead of charging $250. That's the beauty of a network. And that's the beauty of having zero copay, zero deductible, zero coinsurance. But the price is you don't have the freedom to go anywhere you want to, which is it's not really a big deal if you look at the plan and make sure the doctors you like are in the network. And the good news is many of the plans now have a lot of doctors in the network. Yes, question?
Out of town network.
Well, now that's a good question. What about out of town benefits? You want to answer? Yes.
There's plans that are designed to have out of service area benefits. For instance, the PPOs. So there's there's of course HMOs, POS, and BPO plans in the Medicare Advantage. So you have to select that. If you happen to be in Atlanta, it's in a family, you have an emergency, you can reach out to the emergency room regardless, whatever in the 50 states. So Medicare Advantage plans have the advantage, that's what it's called advantage, has a different from traditional Medicare. But traditional Medicare is only within the United States area, 50 states. But you cannot have service outside in other foreign countries. But Medicare Advantage plans, they do cover foreign services. That's one of the advantages of the Medicare Advantage plan. So if you happen to be, let's say it's in Europe, on vacation, you need to go to the emergency room, or either for emergency or for urgency. So you can go to the urgent care or the emergency outside, it will be covered. As well, air ambulance and transportation is covered under those particular plans.
Yes. So, keyword, the great question. I'm going to Atlanta for the summer. I want to know that if I go to Atlanta, if something happens, or better yet, I run out of meds and I need to go get my medications while I'm there, will my plan pay for me being in Atlanta, but I live in Miami? Check with your plan to make sure what we call coverage area. Where are they covered? Okay.
As well, doctor.
Yes. Oh, anytime, of course.
It's as well. If you happen to have, because it happens to me, one of my members went to Atlanta, have an accident, and she went to the hospital, and the physicians, the orthopedic physician, wanted to see her as a follow up. What we did was call the plan, and we set up a special visit, so they authorized that for that visit.
Yes.
So to follow up before coming back to Miami.
Is that great? But information is only information until it's applied, and then you become wise. I always say that. You can get this information anywhere, but until you understand it and you can apply it. So how do you apply it? You have to look at your life. You have to say, okay, what are my expenses? What can I afford? What can't I afford? Will it help me to be able to get, $160 covered a month? Or am I okay? Do I have the 20% in the bank so that I don't have to worry about having to have money if something happens or if I need a hospital visit? And that's an individual decision you have to make for yourself, right? So there's two terms I want you to know, HMO and PPO. HMO has a strict network that you have to follow, right? Which you have to get your PCP, your primary care doctor, to authorize anything that you do. So please do not walk into the eye doctor and say, hey, time for my exam, because they're going to say, may I please see your authorization? May I see your referral? And you say, what do you mean? It's time for my annual. That's your permission slip. Your authorization is your permission slip. And your permission slip comes from your PCP. No permission slip, no visit. And the permission comes from the PCP, but the PCP gets it from the insurance plan. So your PCP contacts the insurance and says, hey, this patient needs an eye exam. They're going to go to this doctor. Is it okay? Then they send back a piece of paper electronically that says, okay, for the authorization. You give it to the eye doctor and they say, come on in. But don't make an appointment until you have your piece of paper. You're going to get your feelings hurt. And then you're going to be really upset. I went there and I was there for 3 hours and you didn't send over the authorization and, I wasted my day and my cousin wasted her day because she drove me here. Look, no, act in wisdom. Authorization first, appointment second. Not appointment first and then authorization second. You're going to get your feelings hurt. They will stand there. You'll be waiting. And guess what? Even if you have a doctor that sees you, the plan is not going to play retro, what we call retro, meaning they see you and then they apply to get paid. And then they're not going to be happy. And the next time you go there, they're going to say, I'm sorry, we can't see you because we didn't get paid the last time we saw you. First, authorization. Second, appointment.
Yeah.
In fact, let me start again. PCP first. PCP gets authorization. And third, you get the appointment. Don't wake up in the morning, call your doctor, I got a headache. I need you to make me an authorization to go see a neurologist because I have a headache. Don't work like that. Why do you see the PCP? Because they have to meet a term called, anybody know it? Medically necessary. And I talked to you guys about it before. Not medically I'd like to have. Medically would be a good idea. Medically, my sister did it and she said I should do it too. Medically necessary, meaning there will be bad outcomes if this doesn't happen. So if you wake up in the morning and you think about something that you think you should happen medically, ask yourself this question: what would be the bad outcome if this doesn't happen? And if there's a bad outcome, make an appointment to see your doctor, tell them about the bad outcome that you're concerned about so that they can prepare the authorization and you can get your appointment. But in an HMO, you must stay in the network. So don't get mad with your doctors if they're not in the network. So what can you do if you have someone you want to go to? Call them. Hey, this is Miss Powell, and I'm calling because I heard you're a really good doctor, and I've been having the numbness and tingling in my toesies, and I want to know if you accept Blue Cross Blue Shield. Do you? Oh, good. Okay. Who's the doctor? What's their name? Okay. Can you give me their tax ID? Can you give me their NPI number? Y'all understood that stuff I just said? So why y'all don't nobody ask questions? Okay. You have to get two things. See, you do want to go to someone that you heard is really good. When you get with your doctor, bring two things: the name of the doctor. NPI represents, it's like social security number for providers. Get their NPI, it's their social security number, because they don't know names anymore. They only know numbers. So that doctor that you want to see has been assigned a number called NPI. Your doctor's going to need it to create the authorization. And then how that doctor is going to get paid is that we need to know what their tax ID is, because they're going to submit a bill to the insurance to be paid. So to prepare the authorization for the doctor that you want, we're going to need that information. But if you don't care, just say, my head hurt, give me a neurologist because I think I'm going blind. That's medically necessary. Okay? Now, that's HMO. PPO, you wake up in the morning, got a headache, your vision's getting blurry, and you are certain you may be going blind, and you think you need to see a neurologist because you've been a nurse for 30 years and you've seen it before, and you don't need no doctor to tell you what they know because you already know your own body and you know what to do about it. You go online, you find somebody who's in your network, you call up, make your appointment, and go. You don't need to stop at the PCP. You don't need to get an authorization. You just make your appointment. Yes, ma'am.
But apparently you're paying more
Yes.
for PPO than you are for HMO.
I told you it's pay to play. Pay to pay. You pay more for freedom. You pay more to do what you want to do because it costs more. Because you may go to somebody who costs $600 for an office visit, whereas your insurance plan, if it was an HMO, has already made a contract with another doctor that they can pay $50. So it costs more. Okay? And please stop associating that it's inferior. I know a lot of good doctors who are in networks. Just because it's a network physician doesn't make it an inferior physician. Okay? Yes, ma'am.
So HMO is basically covered under Medicare because they don't want to pay the money or the advantage, Part C plan,
It's a Part C. Yes. Yes.
which is something new.
Well,
Pretty
no, Horses been there for a while.
Oh, yeah.
So start off on 1965, but of course, it will be, it's been improved by the age, by the time. So, but remember, let's go by the concept of the HMO. HMO stands for Health Management Organization, meaning a doctor or a facility will take care of your medical needs. So, meaning that it's preventing under the prevention of new future diseases. So,
Yeah.
which is already, when people age 65, they need to be supervised by a physician. Because if you're free, like a doctor mentioned on the PPO, you select, okay, I have a headache. So now it's time to go to work. So you manage your own care. So as a person, are you, wisely, you think you can manage your own care? So you better be in the hands of the PCP, primary care physician. Why? Because they will have a plan for you, designed for your age, to do this type of test, this type of procedures in order to prevent future really critical diseases.
Yes.
So it's preventing medicine. That's under HMO. That's really highly recommended to everybody.
Yeah. Think of your PCP as your preventative. I always say we're the mechanics. Do your tune-up. Your preventative doctor, your PCP, is there for your tune-ups. You get on a nice little rhythm. Every 3 to 4 months, you get your oil change. Every 3 to 4 months, depending on your medical condition, you go see your mechanic called your doctor. That's your body mechanic. Now, if something unusual pops up while you're getting your tune-up, like say you got a leak, then we'll, if you're a general mechanic, send you out to one that works with radiators, right? That's in many ways what your PCP does. In the meantime, they'll check your oil, that's draw your blood, make sure there's nothing in it, check your eyes, your headlights, check the under the hood with your pelvic exam as a woman, rotate the tires, check all the parts to make sure they're moving right. And if anything's squeaking or creaking, we'll get an x-ray if necessary and perform a treatment plan for it. So you do those preventative. Question in the back.
Yeah. Okay, I went to the hospital, emergency. I had my appendix taken out.
Ooh.
And that surgery needed right away. So I'm 65. I'm on Medicare. I'm on Medicaid.
Oh,
Why
good.
did I get a bill?
So now here, and I got plenty of bills. I think I'm the $1 million baby because there are many bills that you're going to get once you go in a hospital, especially when you have more than one payer for your insurance. So I didn't talk about Medicaid, so I'm going to talk a little bit about it. Medicaid is based on income, right? It's based on your income. It is paid by two places. One, the federal government, and the other, correct, is the state government. Now, here's the tricky part about this. Not easy. We understand Fed because it's the federal government, just like we know Medicare, which means with Medicare, you can go anywhere in the country. It doesn't matter where you go and get service. With Medicaid, it is state funded also, so you have to meet criteria. You have to fit the description. And guess what? It changes all the time. Sometimes you own a house, you can't get it. Sometimes you own a house, you can get it. Sometimes you have a car, you can get it. Sometimes you don't have a car. Sometimes you have kids, you don't get it. Sometimes you don't have it. And it changes from state to state to state. So if you live here in South Florida and move to New York, you may qualify in New York, but not qualify in South Florida, right? So here's how it's supposed to work. If you have both Medicare and Medicaid, your bill is covered by Medicare. That 20% that you should be paying, if you have Medicaid, should be paid for by Medicaid, with a couple exceptions. First is what happened to my $1 million baby bills. They don't bill the secondary. It's called secondary. They don't bill them. They only record you as having one payer. So then you have to send them a letter with a copy of your Medicaid, in your case, and say, please bill my secondary to Medicaid. It's tricky. It's tricky. Okay? So you send the letter. The next thing, they'll look at the letter and say, we don't have this information. So they're going to send it in, and then it may come back rejected. Why would it be rejected? Because the services, what was done while you were there, also have to meet, they have to qualify for payment by Medicaid. So if they do something or treat you with something that's not paid for by Medicaid, example, Medicaid pays for ibuprofen, but while you're in the hospital, they gave you naproxen. They'll say, we don't pay for naproxen. We only pay for ibuprofen. That will be something not paid for because it doesn't qualify. And guess who gets the bill now for the naproxen? You do. So read your bills. But the first step is to send a letter and make sure they submit it to your secondary. And that could be Medicaid, it could be Blue Cross, it could be United. Many people who work for an organization also have, they continue paying for what we call a supplemental insurance. But make sure that they have that. And don't believe, like in my case, every time I went in the hospital, I gave them both. And a year later, they still act like they never got any, even though I've given to them at least 6 or 8 times. It's just a process. Don't get upset. I don't get upset anymore. I just go through the process. Here's a copy, faxing it to you, emailing it to you, and you just go through the process. Okay? Yeah, just go through the process. But remember, it has to meet criteria.
Just to, for example, some of the members that don't have, who has only Medicare, straight Medicare, without Medicaid. Okay, you're entitled to Medicaid. Doesn't hurt to apply to children and family and get their Medicaid coming to you as a supplementary. They do the evaluation based on your income. It's called low income subsidiary. So they have to do the analysis. So that could be done through the children and family. We offer as well the services. So we help them, the members, to get that QMB, qualified Medicare beneficiary, which is a plan made up for Medicare members. So what it's going to do, the Medicaid, it's going to help you to pay the Part B premium, and as well the extra benefits, and as well will enhance your services.
Awesome.
Under the plan.
Okay. Also, as we're talking about the different plans, and we didn't introduce, you didn't cover.
So, me as an agent, I represent all of the plans in Dade County. So we are having today's devoted health plans, which is one of the best health plans in town, as well the others. All the plans are good.
Why? Wait. Yeah, come on, come over here. Okay. All right. So my friend here just made a claim.
Yes.
I'm about being straight. So this is my mic here. So sure. You just made the claim that it's one of the best plans. Anybody want to know why he says that?
Yes.
Okay.
Because for me as an agent, when let's say I feel comfortable with the plan that offers services. We want to look for services. Why? Because you have a question and you call them as the only plan, comparing to the major plans that will answer your call within 30 seconds. So then follow ups, whatever procedures.
Oh, okay. So
I represent all the plans.
So